This is the Transition Series Topics for the EMT. Topic 11, EMS Pharmacology. Our objectives are to look at the frequency with which certain medical emergencies occur that often require drug therapy, discuss the ways drugs can affect cellular metabolism, review select pharmacologic agents and the medical emergencies that warrant them. The scope of practice for EMTs regarding drug therapy continues to expand as evidence establishes which medicines are safe and effective for use in the field. Understanding how a drug works is integral to making it work correctly. Staying current with new pharmacologic treatments is an ongoing task. We must expect to learn new medicines and their appropriate applications throughout our careers as EMTs. The EMT is responsible to recognize medical problems that warrant pre-hospital drug therapy. We must understand the pathophysiology behind the patient's condition, the actions of the drug, and the expected physiologic response. Epidemiology is the study of the frequency and distribution of diseases. Consider the number of patients with illnesses or emergencies requiring drug therapy by the EMT. Oxygen is very frequently required by patients with hypoxia and hypoxemia. Hypoglycemia occurs in 1 in 1,000 people and often requires oral glucose administration. 7 to 8 million people a year seek medical attention for chest pain of cardiac origin and often receive oxygen, aspirin, and nitro. 41 million people have severe allergies. They are often prescribed an EpiPen. Over 35,000 patients a year die from overdose. Respiratory distress is the most common reason for EMS to be called. Many of these patients will have one of the 600 million multi-dose inhalers, or MDIs, sold in the United States each year. The administration of drugs to the patient is done to alter cellular activity, not to make a cell do something it can't normally do. Signs and symptoms seen in patients are directly due to cellular dysfunction at some level. Drugs alter cellular activity in the hopes of returning the patient to a more normal state and certainly preventing death. Most drugs alter cellular activity by manipulating a target cell's receptor sites. This in turn alters intracellular activity. There are two categories of cellular receptor sites: agonists and antagonists. Agonist receptor sites, and hence agonist drugs, are those that stimulate the receptor sites on the cell to cause an effect, whereas antagonist receptor sites and drugs block the receptor sites to inhibit certain cellular functions. This alteration of cellular activity, in turn, affects the action of the tissues and organ systems they are part of, culminating in the desired clinical effect. Oxygen is a medication. It is the most commonly used medication in EMS. Many diseases limit the amount of oxygen available in the bloodstream. By enhancing the oxygen content of the air, we can often improve the amount of oxygen reaching the cells. In the absence of oxygen, our cells can use anaerobic metabolism briefly, but will die very soon. Brain and kidney cells are particularly sensitive to decreased oxygen supply. Oral glucose is a viscous gel used in acute diabetic emergencies. Cellular metabolism requires glucose. Hypoglycemic patients need sugar as soon as it can be safely given. Glucose can be administered to the oral membranes and rapidly absorbed, but it should not be given if the patient is not able to manage their own airway. Aspirin in a pill form may be administered for chest pain when a heart attack is suspected. Patients with chest pain who have no allergy to aspirin should receive it as quickly as possible. Aspirin, noted ASA, decreases the tendency of blood to form clots and may actually help dissolve existing clots. Giving a patient a chewable aspirin allows the medicine to be absorbed quickly from the oral mucous membranes. The EMT may assist the patient with the administration of nitroglycerin prescribed for chest pain. Nitroglycerin tablets are a common form. Nitroglycerin spray is the other common form. Nitro can quickly relieve the cardiac workload by dilating peripheral vessels and lowering the blood pressure. It should never be repeated more frequently than 5 minutes after the previous dose, and never for more than 3 doses. If rest and nitroglycerin relieve chest pain, it is probably not the pain caused by a blocked coronary artery. Blocked coronary arteries result in cardiac tissue death, referred to as myocardial infarction, or MI. An epinephrine autoinjector, such as the EpiPen, may be prescribed for patients with a history of severe allergic or anaphylactic reactions. These patients have often constricted airways with loud wheezing, as well as areas of redness and rapid swelling. Epinephrine is a form of adrenaline and stimulates the sympathetic branch of the autonomic nervous system. The sympathetic branch has 2 receptor types, alpha and beta. Each has specific responses to epinephrine that help combat the symptoms of the allergic reaction. Stimulation of alpha receptors causes peripheral vasoconstriction and limits edema. Stimulation of beta receptors causes bronchial smooth muscle relaxation, allowing air passages to open wider. Activated charcoal is administered in suspension form. It's rarely used in the field. While it is taken orally for poisoning, it binds poison while it's still in the stomach. This avoids systemic absorption of the poisons and the harm that would result. A metered dose inhaler with a spacer may be prescribed for respiratory conditions, such as asthma. These inhalers usually stimulate the beta-2 sites in the lungs, causing smooth muscle to relax and the airway to open wider. Nebulizers may be used to deliver nebulized medications, such as beta-2 agonists, in a vapor form. Although this was once reserved for the emergency room, it has proved to be so safe and effective that it is now commonly carried by EMS providers. Refer to this chart for a more in-depth explanation of the generic name, common trade names, mechanisms of action, indications, and administration routes for each of these medicines. These charts are found in your book on Table 11.1. When cellular activity changes due to illness or disease, signs and symptoms will be present. The EMT must interpret the findings, tracking the problem back to the body system causing the disturbance. Drug therapy can then be guided by the failing body system. We will address specific conditions and the appropriate medications in subsequent topics. In various medical emergencies, different drugs may be used. These tables demonstrate, for example, in a myocardial infarction, what the history might be, what the assessment might find, and what medications might be appropriate. Review these medications in your book. General treatment guidelines include ensuring an open airway, providing oxygen, positioning the patient appropriately, administering medications based on indications, arranging for ALS backup or intercept when appropriate, and providing transport to the emergency department. Regardless of the specific etiology causing the medical emergency, salient assessment steps and interventions must always be performed. Time is of the essence for an unstable patient, so interventions that the EMT employs must be executed efficiently and expediently. Remember to repeat your assessment and the effectiveness of the interventions to make sure that they're working as well and as fast as possible. In summary, pharmacology administration is a common skill that EMTs must provide. Understanding how a drug works on the body will make it easier to determine when it would be necessary. With any drug therapy, ensure that you have the proper medical direction prior to administering the medication.